Hi, my name is Lauren Kirchner. I'm a physician internist with previously with the Cleveland Clinic up in Worcester for many years, and I started down in with Pomerene. It's about a year now, so we're over in Berlin. But my interest has long time been in nutrition and health. So I've been invited, and I'm thankful for it. I'm very thankful to be here. It's a privilege for me to be able to talk, but I talk about nutrition, and that's kind of the where my focus is in medicine. I like to use the medicines only if necessary. We're kind of a nutritional-based approach to things. So, and when I look at medicine in general, particularly if I could do a health talk, and we only have like 20 minutes, 25 minutes, I guess, with these sessions. What I wanted to focus on, and what I always use as the analogy is the low-hanging fruit approach. Some of you have heard of the low-hanging fruit approach to things. And that is, I'm going to pick the biggest, juiciest low-hanging fruit because it's right there, but it's also going to give us the biggest potential gain, right? Best improvement, so to speak. The one that I'm going to talking about, since this is Heart Disease Month, if you're not aware of that, it's Heart Disease Month. I decided to focus on what we refer to as the omega fatty acids in our heart. So heart disease, very, very common. Still, in the United States, in much of the world actually, still the #1 killer as far as how we're ultimately going to die. Is still a high percentage of patients who are ultimately going to get heart disease. By heart disease, I'm talking about blocked arteries. That's the predominant form of heart disease. So the things that people get bypass surgery for, right, stents, and a whole boatload of medicines to go along with it. That's what we're talking about, that sort of stuff. So we're going to show you a little bit about what that is. But I'm also focusing on the prevention, right? This is about prevention. This is about health. I want to talk to people about how to put a stent in their heart. You want to talk about how not to get a stent in your heart, right? How not to have that happen. If you've never seen a heart, and hopefully it doesn't turn you away from your pizza or whatever you're eating, okay? This is a human heart, obviously out of somebody, so they didn't fare so good with their heart attack, right? Because otherwise we wouldn't be sitting on the table here. This is just an example. This is what we commonly know, right? Somebody gets a heart attack. The chest pain starts. They're in the middle of a heart attack. What does it mean? It means that you got a blocked artery in the heart someplace. This is the entire human heart, basically. What's drawn on or shown on the front of this is something called the LAD. Anybody have a stent? Anybody know somebody have a stent in their heart yet? Probably a few of you. There's the most common place that these things end up in is called the LAD. If anyone ever heard of that term, LAD, in a heart? It's often referred to as the, quote, widowmaker. It's the one, if you have a heart attack in that vessel, you have a pretty good chance of not surviving it. It's a very common, though, place. So this is a particular example. But what I want to show here is that, okay, you got the LAD, and what we're trying to demonstrate, or what we're going to get to ultimately, is about how this happens, in particular in relationship to what we refer to as omega-6 fatty acids in our diet. And we're going to talk about where those come from, in particular, in our diet. But what's actually driving this? Cholesterol that we measure all the time plays a part. How big of a part? It plays a modest part. It is not the ultimate culprit here. The ultimate culprit of leading to blocked arteries is what we refer to as inflammation. Inflammation. So we all think of inflammation, you twist your ankle and it gets red hot and swollen and all that kind of stuff. That's inflammation too. But we get inflamed internally in these arteries, and it's based upon what we're eating for the most part that's driving that inflammation. Cholesterol is a part, but it's not the main issue here. And that's what we're going to kind of focus on here a second. If you look at this, took this thing out, this LAD, and you stripped it off of the heart and you sliced it in half, this is what you would see. I know it's probably not showing up the greatest, but if you look around the outside of this is a pipe, in a sense. It's supposed to be carrying blood. This is the normal diameter of that thing. This space is all that's left for blood to flow through. The rest of this is a cholesterol plaque. That's what we stent in the heart. So when they put a stent in here, they simply put it through the space here, and then they open a stent up in there, and it struts the vessel open so that you can get more flow through there. That's all they're doing. Are they fixing anything? Not really. But they open it up for temporarily. It's like a roto-rooter treatment in a sense. You know, you open it up temporarily, but eventually it plugs up again. If you continue to do the same foods that drive this, that's where we end up. We're going to end up right back at it. This is a cartoon over time that simply shows that, yeah, we get inflammation of the vessel wall. Eventually, cholesterol builds up in that vessel wall. This whole process could take 20 to 30 years or longer. It's a very slow inflammatory process. It's not like your ankle that got red hot and swollen and then went away in a week. This goes on for decades before it ultimately blocks off. Okay? Let's hit the next slide here. So, we got to talk real quick about fatty acids. Fats, because that's what the omega-6 is. And we're ultimately going to get to the heart of the matter with the omega-6. Where's it coming from? Well, when we talk about fats overall, we're talking about what we refer to as fatty acids. You all recognize all those things, right? These are all just examples of fatty foods, deep-fried everything, right? It's got lots of fats, vegetable fats mostly, but still fats nonetheless. That's what the problem is, and we'll show exactly how this works. Let's hit the next slide here real quick. I'm going to skip through this one, just in sake of time here. I'm sorry about that. Can we go back once, then go back one slide? I think one more. Then try and just go. If you've not, who's heard of fish oil? Who's taking fish oil? Someone's taking fish oil here, right? There's a lot of talk right now about fish oil. Something called omega-3, right? Most of us don't have any idea in a sense, and I understand this, about why we would take omega-3 and how it affects our bodies, because it's an anti-inflammatory type of compound. But the real culprit to the problem is not that we're short somehow or deficient somehow in omega-3 fat. It's a very particular type of fat. But the issue is that we're very overloaded in something called omega-6. It's a particular type of fat that we're going to find in a lot of our foods. The bottom section here is the only thing I'm going to talk about on this slide, just in sake of time. Omega-6 and omega-3 are two very particular types of fat that we would have in our diets. We could have in our diets. Those two compounds are what regulates everything to do in our body about inflammation. Again, if you twisted your ankle, got red hot and swollen and painful, that was activated inflammation. It was supposed to do that so that we didn't walk on it and we allowed it to heal then, right? So when the hurt goes away, then we can start walking on it again. The action, what was going on there, the triggering of the inflammation process in the body was being directed by something called omega-6. Omega-3 does the exact opposite of that. It shuts off inflammation in the body. These two, though, fats are very, very interesting. And of all the thousands of different types of fats that we have in our body, because we have many different thousands of different types of fat molecules, in a sense, we as human beings can make every one of them. We could make every one of those fats from other substances except for two things, omega-3 and omega-6. I don't know why exactly that is, but that's just the way it is. But they are the two and the only two that regulate the inflammatory system, and everything to do with inflammation in the body is regulated by those two things. That is why they are called essential, not just in human beings, but all animals use the same thing to regulate their inflammatory process. We absolutely have a requirement to eat those as they would be in the foods, not because we can't make them internally. It's a very important point with this. Let's hit the next thing. And I say it again, we cannot make omega-3 or omega-6. We have to consume them. But those two things were meant to be consumed in a balance. Very small amounts in balance. If they're not in balance, then we're going to shift this, particularly towards the omega-6, we're going to shift it towards what we refer to as pro-inflammatory. It's going to keep inflammation activated all the time. That's what drives heart disease and many other medical problems behind the scene, but that's what drives heart disease. It leads to the plaquing, is that we can't control that because we consume too much omega-6. Let's hit the next one. Once again, this is just a little bit of a summary, and there's 2 points at the bottom. The simplest way I can say this, omega-6 leads to greater inflammation in the body. Omega-3 leads to less inflammation in the body. That's why Larry King's selling omega-3 on TV now, and all these other people, everybody's got an omega-3 product out there because it's useful as an anti-inflammatory. But the problem is the overconsumption side, and it's simply a recognition on our parts, all of our parts, is where does it creep into the diet? How are we getting it? Let's hit the next slide. I'm going to show you, this is a real complicated medical sort of slide thing, but it's a pathway just to emphasize a little bit about what's driving this thing, this heart disease. Ultimately, everything, again, below, so this omega-6, and we say the omega-6 family, all these substances, these are just different fatty acid compounds. All of these end up in this pink category, which leads to higher inflammation. That's what this is. All of the things that come from the omega-3 side of the house, or omega-3 family, all of these things, and there's about 100 compounds in that group. This is only part of them. That is what shuts this off, leads to open arteries, ideally in the preventive way. So in other words, long term, the way we would eat our diet over a long term without omega, or keeping these omega-3 and omega-6 in balance, leading to keeping these arteries open and not getting to that point. You get to that point, you're in dire straits. Bad thing. Let's hit the next one. This is a little bit of, if you're not used to reading graphs, I'll walk you through this, 2 graphs. There's 2 that are important here to make a couple of points. This slide and the next one. This slide is showing us, for one, if you're not used to reading a graphical presentation this way of a graph, we're graphing data, so to speak. On this side over here is what we call this is the coronary heart disease death rate in various populations of people. And it's listed as 200, 150, 100, et cetera, per 100,000. In America, is way up at the top of the list up here, by the way. So we're somewhere in that 200,000 people per year, 200 per 100,000 people per year who die from heart disease. We have a very high rate. We are amongst the top in the world on this. If you look down through some of these other countries, you see that the graph goes down this way and the number's lower. So Greenland, for instance, you come over here, they would have about 20 per 100,000. The Mediterranean population's about 100 per 100,000. And again, we lead the world. This next slide is going to show what I think is very, very telling information, and why I can stand here today, in a sense, and say, well, look, cholesterol is important. It's important to a certain degree in terms of the risk of dying from heart attacks or having heart disease, but it's not the entire thing. And in fact, inflammation that drives that is what allows the cholesterol to come into the plaques to begin with. It's an inflammatory problem. This is a bit of a complicated, but we'll walk real quick through it. On this axis over here, on this side, is what we call the coronary heart disease again. This is the coronary heart disease mortality or death rate overtaking a population of people. we're doing it in a study. We're taking a population of people, X number of people, and we're going to follow them for 10 years and see what happens, or 25 years and see what happens to them. This is 25 years of information packed onto this slide for various populations. What are the populations? You got Northern Europe, USA, Serbia, it's up towards Russia, Southern Europe, which would be Italy and those areas, Crete, which is the island in the Mediterranean as well, and then Japan. Just different parts of the world, and looking at their heart disease death rate, right? So it's these different populations. Now, when we look at it from a cholesterol standpoint alone, this would be, I'm just going to point it out. So the triangle one, these guys right here, these lines, this is America's line right here. And what it's saying is this: the higher your cholesterol goes, the higher the mortality or death rate goes. That's pretty straightforward, right? Makes sense. That's what we're all told, and that's the important part of checking cholesterol, and it is important. The higher your cholesterol goes, the higher the risk of dying of heart disease. Bottom line, it's true about cholesterol that way. But here's the caveat to this. Here's the caveat. These other numbers that are over here on the side, 80, 75, 65, 60, 40, those represent, in those populations of people, how much of this omega-6 that they have in their cells of the body. In other words, what they ate that translated into what gets into their cells relative to the amount of omega-3. Hopefully that makes sense. So, for instance, Japanese, they carry in their cells typically about 40% omega-6, and 60% then the opposite of that is omega-3, if that makes sense. Hopefully it makes some sense. Crete is about 50-50. America, we have about 75% omega-6 and about 25% omega-3 in our cells. What does that translate into then? When you put all of that information together, what's happening here is as we go higher in omega-6, we go this way, higher omega-6, it's going to lead to more and more heart disease. But the cholesterol only plays a part of the role in that. So it's that high cholesterol is only a small part of the issue of heart disease. Inflammation is driving it. The high levels of omega-6 in our bodies drive that process. And another way to look at this is if you look at Japan, they carry 40% omega-6 in their cells, which means they got a much higher omega-3. They have 60% omega-3. If you look across this, it doesn't matter what their cholesterol level is. They have the same risk of heart disease, and it's very, very low. Does that make sense? They have the lowest risk of heart disease, and it doesn't matter what the cholesterol is. As the amount of omega-6 goes up, the cholesterol levels are much more important. We can fix this without drugs and medications by staying away from omega-6. We would then fall into this same category down here. Our cholesterol would be much less important. It really wouldn't be an issue at all. If that makes sense, hopefully. Where does the omega-6 come from? That's the biggest question then. After all that, that. When the United States back in the 1940s and 1950s wholesalely converted over to vegetable oil, we were all told, in a sense, don't eat butter, but eat margarine. Don't eat lard, eat Crisco. All those kinds of things. Well, inadvertently, that was done mostly through the activities of the federal government as well as industry to say, look, okay, meat and animal fats were raising our cholesterol, so let's get away from animal fat. The consequence was that we shifted wholesale over to vegetable oil. By the 1980s, this was complete. And in fact, today, we still consume far more vegetable oil than any animal fat. We still do that. that has driven this problem. Why? Is because all of these vegetable oils are very, very high, and all the products that come from it are very, very high in omega-6. That's where the source is. Let's hit the next couple of slides here. Just to show a little bit about what the makeup of these oils are, real quick. A lot of people, sorry, can we postpone? Okay, thank you. Canola. A lot of people using canola today. The little white bar over here is the amount of omega-3. The little white portion, the slash portion, which is about twice as much, 2 to 3 times as much 6 than 3 in canola oil. Sunflower is almost entirely, as well as safflower, almost entirely omega-6. These oils contain massive amounts of omega-6. We as human beings, by all data that we know about analyzing over the years, historical, current, everything, looking back in time and looking to where we're at right now, all indications would suggest that we should consume about 1 to 2 grams of omega-6 and 1 to 2 grams of omega-3 per day. We, on average, American right now consumes about 30 times more omega-6 than omega-3. What's driving it? Go back to those slides. Potato chips, fries, deep-fried foods, all the things that contain vegetable oils. That's the main source of this stuff. We're consuming about 30 times more than what we are supposed to today. 30 times on average. That's driving it's driving the whole problem as far as I'm concerned in terms of this imbalance. Let's hit a couple more. What do you do? How do you deal with this? For one, look, this stuff shows you can't see it, I'm sorry for the distance, but I can look at all the labels and I will find vegetable oil. It's in all these things. If you look at just one of them modest size bags of chips, I could probably gobble one of those bags up, 50 chips, pretty easy. That gives you about 10 or 12 grams per day if you did one of those a day, about 12 grams of omega-6. And no omega-3, has almost none, very little. The first place from my standpoint to change course with this is you got to reduce the consumption of it. If people would consume it at the same rate that most people are, and we tried to supplement to balance things out with fish oil, it wouldn't work. It wouldn't work. You'd have to take a half a bottle a day of fish oil, and it ain't going to work. It would be impossible. Cutting back is the key to this whole thing. Let's hit the next slide. All the green leafy vegetables, salmon and fish oils, all these kind of things, these are all high in omega-3, but all the vegetables have usually about 2 or 3 times more 3 than 6. They have more 3 than 6. It's a nice way to balance things out by increasing the amount of vegetable intake versus the other foods. Let's hit the next one real quick. The one that makes the most sense overall to me is simply, this is a 3-way. You could do the reduction, you could do the increase the omega-3, or you can do both. And that's kind of the philosophy that I have taken is simply to balance it out. We cut back on the omega-6, cut back on the vegetable oils, the mazolas, Criscos, lards, all that, margarines. Don't be fooled by little labels that say on margarine, you get these little red stickers on them now that says high in omega-3. Don't work. It doesn't work because it's still about 10 times more 6 in it than 3 in that same product. Even though it's got a good amount of omega-3, it's a disaster. I would not do that. But the gist of it, cutting back on 6, supplementing with omega-3, or certainly trying to increase the amount of fish in the diet, that's helpful. The fish oil supplements, cod livers, those kinds of things, they can boost the omega-3 significantly. So those types of things are helpful. But as far as real practical purposes, if we simply cut the vegetable oil out as much as possible, it would be significantly better. You'd really avoid a lot of the potential complications. This is the kind of thing that there's some young folks, there's middle age, et cetera, here, a few older folks. But, this is the kind of thing that starts in very early in life, by the way, by today's standards, because we're all exposed to so much vegetable oil. If we do this long term, you cut back the risks of these inflammatory types of problems like heart disease and many others. It's well documented, good science that's behind that as well. So I'll stop with that, and we'll kind of reset. I think that was it. Yeah, that was the end of it. Are there any questions on it? I think we have to switch, or take time.
What do you substitute instead of the vegetable?
The two that are okay for just oils, as far as I'm concerned, olive oil. Peanut is very high in 6. Very high in omega-6. Coconut and olive are the two. Coconut oil is what we call saturated fat for the most part. It resembles almost animal fat in that way. Animal fats are mostly saturated. To me, not a bad deal overall. And again, olive oil would be the other ones. But as far as cooking, those would be about it. There's a lot of the oils don't heat very well, so it's hard to cook with them. They smoke a lot and stuff. So, but these you can cook reasonable, small amounts with. Deep fried anything is just, I can't say enough. It is just such a massive amount of this omega-6. And it stores in this. Body stores it very well. It hangs on to it. And it's been estimated, it takes about 2 years from when we cease eating it before it's going to show about a half reduction in it in the body. So if we've been eating it for a lot of years, it takes a long time to go back out. Well, frying in butter, as far as I'm concerned, isn't that bad. In fact, we've always, personally, and because I've been a medical doc for a long time, but it's been a student of nutrition for at least that long, And we never switched, so we never used margarine. We've always used butter, whole milk. I grew up on a dairy farm, so I'm used to that stuff too. But it was one of those things. Switching to the margarine was just a total disaster. But the products where that omega-6 is very high in, I showed some of the other things briefly, was like salad dressings, all of them. The average serving size of salad dressing that we'll dump on a salad, that nice blue cheese thingies and all that stuff, is going to get about 10 grams of omega-6 out of per serving, which is about 10 times what we're supposed to eat per day, right there. And, if you do that and something else in a day, you could easily see how you get 20 to 30 times more 6 than we do 3. It really shuts that off. So mayonnaises, salad dressings, a lot of products have omega-6 in it. Keeping the food simple and staying away from vegetable oils as far as this one goes. This is a real big deal. And again, I picked this because personally, if I have to say of practicing for a long time in medicine and knowing this stuff in the way, that is truly the low-hanging fruit one. That's, if somebody could change one thing in their diet and the way they eat, that would be it right there. That would be it. And then, then you work from there. But that's a key point. This is the one that creeps up over many, many years, and then eventually it causes the heart attacks and et cetera. So it's a thing to think about. Okay? Any other thoughts, questions? Or I think we're good.